Hi, welcome. My name is Dr. Kat Kesty, and today we're going to be talking about using lasers to treat acne and acne scars. So let's dive right in. A very common question that I get from people who are getting into lasers and also patients is, can I treat active acne and acne scars at the same time? And the answer is absolutely yes, you can. You do not have to wait until the acne is cleared up to start treating the acne scars. You can treat the acne and the acne scars at the same time in the same laser session. Let's talk about what lasers I like to use for acne and why. I love my vascular lasers for acne. This is going to be 532, 595, and 64. All of those have really great data on using them for acne and rosacea. Another device that I really like would be my IPL or BBL. Using some of the acne-specific filters in the 400s are going to be your best bet. But sometimes I will couple that filter with a vascular filter, in 530s, 560s, just to target some of the redness and erythema around the acne lesions itself. Other lasers that can help are some very gentle resurfacing lasers. So sometimes I'll combine a gentle erbium, a gentle CO2, a gentle 1550 or 1927, even some radiofrequency microneedling and some straight radiofrequency devices can help with acne as well. So when you're treating a patient with acne, you have a lot of options with lasers to help them treat their acne. A caveat to that is, as a dermatologist, I usually will put patients struggling with acne on some sort of home regimen as well, whether that's some acne pads, a prescription acne medicine, a compounded acne medicine, just to help them in the days when they're not in getting lasers. Let's talk about what lasers you can use to treat acne scars. Your workhorses to treat acne scars are going to be your ablative lasers, so your erbium and your CO2. Depending on what type of scar it is and how deep, you can use fully ablative modes, you can use fractional modes, you can combine fully ablative with fractional. Those are going to be the ones that we reach for the most for acne scars. Other lasers that are really great for acne scars would be your fractional non-ablative. So this would be your 1550, your 1927, other lasers that are going to leave the skin intact but still go deep. These are going to be a great option for your patients that have acne scars but don't have the downtime for the ablative lasers. Other energy-based devices that you could use would be some radiofrequency microneedling and some other sublative devices that can help a little bit with acne scars. Another common question I get is, I have a patient with Fitzpatrick skin type 5 or 6. Can I treat their acne scars? And I would say absolutely yes. My two favorite lasers to treat darker skin types with acne scars would be your 1550 and your erbium. So your 1550 I like because it goes so deep, it actually leaves those melanocytes in the basal layer completely alone, and it just targets that deep collagen. I love the ablative erbium YAG. So this is going to be your 2940 wavelength because it's a cold laser. So you're not adding any extra heat like you would with the CO2. You're not disrupting those melanocytes in the basal layer. So you can still get a great result with acne scars safely in all skin types. Lasers are going to be your workhorse. You're going to use them all the time on those patients. But there are a couple things that we can talk about that will enhance your laser results. The first one would be TCA cross, which is where you take a TCA very high solution, too high to put all over the face. You put it on a little toothpick and you put it right in the depression of those really deep acne scars. So I'm putting it right at the bottom. And what that's going to do is build collagen right at the deep part of the scar and help it kind of fluff up to meet the rest of the skin. The other thing that's really helpful for my acne patients would be subcision, where I take saline or preferably their own platelet-rich plasma, and I inject it under the scars. And what I'm doing is two things. I'm building collagen deep, and I'm breaking all those fascial tethers that can pull down on the scars and make them kind of permanent. So we're building collagen from the top with the lasers, and we're breaking those fascial tethers and building collagen deep to help even out the skin for the patient with the acne scars. When you're talking about using lasers to treat acne scars, we have to keep the risks and the potential side effects in mind. You want to choose the right laser for the right patient. You want to take into consideration their downtime, their lifestyle, their skin type, the amount of sun exposure that they get. and decide whether you're going to do a really, really aggressive CO2 fully ablative procedure on them or something really gentle like a 1064 photofacial or light 15/15/1927 or anything in between. There are so many options to treat acne scars. So you want to do it safely for the patient. Choose the right laser and the right settings to get those really amazing results. Treat their acne scars, give them a huge boost of confidence, but do it safely.